Hey there, Careblazer, welcome back. In today's video, I want to talk about vascular dementia. What is it? What causes it? And vascular dementia is considered the second most common type of dementia after Alzheimer's disease. So let's just get clear on what is vascular dementia. First of all, it's vascular in nature, which means that it is affected by blood flow. It's an issue of adequate blood flow getting to the brain. So anything that negatively affects blood flow from getting to the brain is a risk factor for vascular dementia. There are many different medical conditions that are considered vascular risk factors that impact blood flow to the brain. I'll get to that list in just a moment, but the most common one that you hear about often and that leads to vascular dementia is stroke. In the past, vascular dementia used to be called something called multi-infarct dementia, which was just a fancier way of saying multiple strokes. And so stroke is a really common thing that can lead to vascular dementia. Not everyone who has a stroke gets vascular dementia. However, you are at very high risk to get vascular dementia if you've had a stroke. So basically, after having a stroke, blood flow was stopped to a certain area of the brain for a certain amount of time. Depending on what area of the brain the blood flow was stopped, that determines what symptoms and difficulties somebody has. Depending on how long that blood flow stopped to the brain, that determines the severity of how bad the difficulties are, how bad the thinking problems are. So some people can have a stroke and they can come out of it okay with very mild changes. Some people can have a stroke and they have a lot of thinking problems after the stroke, but after going through rehab and doing cognitive rehab, they regain a lot of their thinking skills so they don't meet criteria for dementia. And then some people have a stroke and despite going through all that rehab, their brain never recovered and they meet criteria for vascular dementia, meaning they are having significant difficulty doing basic thinking skills. So getting imaging of the brain, the doctor might order imaging of the brain and they can identify, they can see the stroke. Now, another risk factor for vascular dementia is something called TIAs, transient ischemic attacks. They're basically like mini strokes. Sometimes people refer to them that way. And those are not easily identified on a brain scan. But what happens is somebody's having these little tiny mini strokes and afterwards they recover pretty well. There's a lot of times they're not even going to get medical attention or anything. And it seems like it didn't do much to the person's brain, but it places that person at really high risk for a future stroke and at really high risk for vascular dementia. All right, so other common risk factors for vascular dementia include things like diabetes, high blood pressure, smoking, history of heart attack, high cholesterol, obesity, atrial fibrillation, otherwise known as AFib, and hardening of the arteries. Over time, these conditions make it difficult for adequate blood flow to get to the brain, and so the brain starts to suffer. Now, because we're talking about blood flow to the brain, any part of the brain can be affected in vascular dementia. So that's why the symptoms of vascular dementia can look so different from one person to the next. It really matters just where the blood flow is having problems getting to in the brain. Those are whatever area that is, whatever part of the brain is not getting that blood flow, there's different parts of the brain that are responsible for different thinking skills. So that determines what symptoms the person's having. So depending on how severe the blood flow access is to the brain, that can determine the severity of the dementia. So somebody might have a stroke, but it was able to receive medical attention quicker than somebody else who had the same stroke. So the one person might come out of it with mild dementia versus somebody else may have come out of it with moderate dementia. So versus Alzheimer's disease, where it's a very gradual progression, you kind of progress through the stages, and vascular dementia, you can have a stroke and wind up in moderate dementia right away. The most important thing to do if your loved one has vascular dementia, or if you yourself are noticing you're at risk for vascular dementia because you have some of the things I listed off earlier in the video, follow up with the primary care providers and work with them on how to control those vascular risk factors. So Careblazer, thank you for your question. I hope that this video helped clear up some of your questions on vascular dementia and how that differs from Alzheimer's disease. If you have any questions you'd like for me to answer in a future video, go ahead and leave it below this video and I will consider it for a future one. All right, Careblazer, keep up the good work. Bye. As you know, there are different types of dementia. Vascular disease, vascular dementia,